Hi friends, I'm Petars. I'm from Bulgaria and I'm 35 years old. I have a son. He's 5 years old. He's a very active boy. I had a bone tumor and I had many problems in Bulgaria. The doctor in Bulgaria said the type of treatment is resection of the humerus and metal protection, prosthesis, excuse me. I lost the movie in the hand. After that, a friend gave me a telephone number of GBDM, and I went to the office in Sofia. There I met Dr. Margaritu, and after that I visited Istanbul. After the visitation, I was operated by Dr. Harzem. He made a very successful surgery, and in the moment I feel better, wonderful. I feel wonderful. I can move the hand, and after the examination, I will learn about my condition, and I know that I'll be good and normal person. I'm a very active person. I was professional sportist in the past when I was young, and I want to be a normal and move the hand, and I want to work. That's my story. About the time I spent in the hospital, that was I was very calm, and I feel I'll be good. The people was very gentle, and they do everything for me. I'm very, how to say, they are in my heart. Thank you.
I am Professor Harzem Ozger. My field is oncologic orthopedy. It's mean our working is about musculoskeletal tumors of the skeleton. It is all kind of tissue from the skeleton, its bone, its cartilage, its muscles, veins, arteries, nerves, everything is on the extremities and the spine and the pelvic region. There is benign and malign tumors in that area, and we treat all them. It is very important to treat this kind of tumors with an experienced team and in those institutions, because they are rare. Not too many people can see this kind of tumors every day. So only in special institution have enough experience about the treatment, diagnosis, and treatment of these tumors. Another thing is there's very different types of these tumors, and every type needs special diagnosis and treatment strategies. So it's again, they should in correct places, correct time, and correct way operated and diagnosed. So this patient is chondrosarcoma. It is a malign tumor of the scapula. The main way of the treat of the tumors is clean the tumor cells from the body. If they are benign tumors, you can go into the tumors and you can curettage it and can put all the tumor tissue out. But if there is a malign tumor, it is so you need special kind of treatment. You should take a space between tumor and healthy tissue. All the tumor should remove from the body, cover it with healthy and enough thick tissue. It's very important. If you left any kind of tumor tissue, any cells, it's replete. It's a recurrence, and you have the tumor, and the following is metastasis, and sometimes lost the patients. So in that kind of malign tumors, we should remove everything with enough white space. If you have this operation, you have a big loss of bone, cartilage, and sometimes soft tissue, and sometimes and joint. You should put everything back, and you should make a reconstruction. You should make everything again. There is two ways. Sometimes we use non-biologic, non-alive tissue, some prosthesis, metals, titanium, everything. It is a way, it's a good way, but it have a duration. You cannot use a prosthesis all the lifetime. After 10 or 15 years, you will have some problems, some breakage, some loosening, everything. The other way, if you can, is my preferred type of reconstruction, is biologic. In this type of reconstruction, we use the parts of the patient or other humans. They are live tissue, and if we can do this reconstruction with kind of tissue, we have a reparation for the lifetime, for all the life. It is difficult. It needs some microsurgery, some special kind of surgery. But if you can do it, it is our gold standard. For this patient, for Peter, it was difficult, but we can do the reconstruction non-biologic with prosthesis. It can be easier. He can use the extremity maybe easier in the shorter time, but it is not all the lifetime. We desire to make a biologic reconstruction, and the kind is it is a method of mine. I give the name. It's hot dog or microsurgery. In that kind, we take the tumor, the bone with tumor, kill everything in a special way, put again back, and take the other from the other leg, the fibula, it's a live bone, with all vessels, and put together inside. In Peter, I do another way. I can spare a part of his own bone. I use it as like a hot dog, as that bone, and put fibula inside. Put together. After this operation, the tumor is removed with safe and clean margins. So it's a very huge tumor. He has his own extremity, own bone, own joint, all the motion, all nerves and vessels, and I hope he is happy.
Very happy.
And after the operation, he can move his arm?
Sure, sure. We need a short time for healing all the soft tissues. Now I will show him how he should move the...
Some practices?
Yes, he do it. And he needs the time to healing the bone. It is transportation like heart or liver transportation, not taking some bone put inside. It's a live bone with all vessels, and we do microsurgical replantation to the vessels. After one or 2 months will heal, and this bone here is now the bone here. Same.
Like a miracle, he said, in his
That's
country.
beautiful,
Yeah?
yes.